had her in the car 5 miles from here. She comes into the emergency room parking lot. She's hanging by her umbilical cord out of mama. The nurses down in the emergency room snip her off. They run her up here, and this is her. She looks like she's maybe 2,300 grams. She has no pulse and no respiration. What you gonna do? Kilgore is downstairs eating in the cafeteria and says he's not coming. You do. You gotta do this till Kilgore gets here. Come on. Miss, turn your badge around. Miss, turn your badge around.
Oh, Sable, sorry.
Miss.
Sable.
Oh, please. Not you. Go away. She's one of the emergency room nurses. She's seen me do this too much. I never pick on the guy. I always pick the girl.
Oh, that's a good thing. Come on.
All right. So, what you gonna do? First thing you gonna do?
Check for pulse.
Nope.
Call the code.
Nope.
Turn the machine
No.
on.
No.
Check it for breath sound.
Nope.
Call for
Nope. 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 And nope. Put some gloves on.
Oh.
This is a mom, you don't know anything about her.
You're
If she has herpes, she has hepatitis B, she's got HIV, she's got GC. When I was in residency in Columbia, we had a baby that had GC on the surface. Mom had no prenatal care. One of the residents never washed his hands. He took it home to his wife. She had it in her eyes, nose, mouth, and vagina. I won't forget that day she came in the nursery and said, I want to see the damn baby that gave me the clap.
Oh, Lord.
And he's like, okay, put your gloves on. You don't know anything about this patient, right? Put your gloves on. Always protect you and protect your family. All right? Gloves on. So what you gonna do?
All right. Wash my hands.
Put the stethoscope on right first. Oh, remember, when you put a stethoscope on, your ears go down and in. So the tips always point up. That makes you hear better. Gives you a better seal. Okay? Go ahead. What you gonna do?
Check for pulse.
Nope. Pulses mean what?
Airway.
Circulation, right?
Airway.
Just the airway. Airway. How you go check for airway?
I'm going to check for chest rising and listen.
Okay. Not breathing.
Not breathing.
So you're gonna open the airway. So what you gonna do to open the airway?
I'm going to try to.
This ain't adult medicine. Don't talk about sweep the mouth and all that kind of
No, I'm
stuff.
trying to feel.
Try again. You can free to ask any of your classmates for a consult. Consult. Come on, Mr. Kimmerman. Come on. What you want to do? Okay, I'll give you that. Put some under the shoulders. What should we do next? Okay, I'll give you that. Smarty pants. I'm using my own words over there.
Somebody turn on some light. Let's put some light on it.
Light.
Alicia. There you go.
Okay, what you gonna do?
All right. So
First of all, you right-handed or left-handed?
right.
Okay? You go turn his head to the right, turn it towards your dominant hand.
Okay.
His head to the right, you use the suction bulb and suction his mouth. Okay? Remember, M comes before N, mouth before nose. So you go suction his mouth first and then suction his nose, right? Now, the mistake I see all the students make is y'all, and it's sticking on his jaw and you doing nothing. When you put it, if he's down and his jaw is like this, do it so it comes up, stick it in, and see how it's in there now, it's in a little pocket. And now you suction the secretions. Because if you just do this, it's gonna stick to his cheek and you're not doing anything. Okay? Put it in, bend it, so it's, can y'all see? So it's like this, so you get some of the puddles in his cheek. Okay? Suction his mouth for me. Okay? Suction his nose. Put it in, get a good seal. Suction. Y'all can't see from over there? Come on. Come on. Because all of y'all gonna do something. Just because you stand up. By the way, if you stand in the back, I'm definitely gonna get you. Nobody stands in the back and you're not helping. You've helped me too many times. You know you know too much about me. Okay. Oh, you're a teacher. Oh, you're a student. You still not
I work in a yard.
You still not helping. Okay? What you gonna do? Show me how you suction the nose. You're gonna put it in and get a good seal. Because too many people do this. If this is his nose, they'll go. Put it in and get a seal. And this is exactly a seal, so you get pressure, so you can get everything out. Babies are obligate nose breathers. They don't know how to breathe through their mouth until they're 4 months old. So a baby with a stopped up nose is the same thing as me putting my hand over your mouth and nose. Okay? Got to get his nose cleared out. Okay? So now, you're taking care of his airway, clear his secretions. What's next? I ain't trying to try again. What's the next letter in the alphabet? Breathing. We'll do breathing. How you gonna make him breathe? All right. Show me how you put a bag on. Miss Gist?
Yes.
Show me how you put a bag on. Always at the head of the bed. You don't know, tell me. That's all right. Say I don't know. Okay, Get it straight. Okay, let's talk about it. All y'all, come around. When you put a bag on, you righty or lefty?
All right.
Okay. When you put a bag on, you always put the chin in first and put it over his nose, so the V is over his nose. Her nose, his nose, okay? Okay, and you go do, they call it the EC technique. Okay? Your fingers are like an E and a C. So you want to put finger here, pull this finger, pull it up the angle of his jaw.
Okay.
Just the angle of the jaw. You gonna pull that up. You gonna put, relax. Okay, this is relax, good, great. This finger goes here. This pulls up here on this chin. This pushes down here. That pushes down there. Okay? It's got an E and a C. So you got a good seal. Okay? Breathe for him. Are you breathing good for him?
No,
How you know?
because it's in the chest and round.
Very good. Okay, so what you gonna do?
You gotta tilt the head.
You don't tilt heads in babies. They already have a big head. So his head is gonna be like this already. You just tilt, you want a straight angle. That's why you put it under here, so to be level. Okay?
Okay.
So what you gonna do? Start over.
Start over.
Okay, let me see. Okay, let me see. What you do, let me see. Okay. Mouth in. Okay, here. Up under the chin. Push down here. Push here and, oh, that's a hole in the bag. That's what's wrong. Okay, but you get the idea. You gonna do this, okay? Okay, and in babies, forget adult medicine. It's the waltz. Breathe 2, 3. Breathe 2, 3.
Yeah.
Breathe 2, 3. And your nurse, my nurse, is her job is to count it off for me. She's gonna say, breathe 2, 3. Breathe 2, 3. It's your job to keep me up straight. And keep the rhythm going. Breathe 2, 3. Breathe 2, 3. Okay? Forget that stuff in adult medicine. 1 and 2. This is neonatal medicine. This is entirely different. Okay? So you're breathing for him. You've got good chest rise. Okay? What's the next thing, Miss Jenkins? Come on. What's the next thing? You got him breathing. You got good chest rise. Okay? What's the next thing?
There you go.
Circulation. Circulation. How you gonna check circulation?
Yep.
Head of the table. Where you gonna check pulses?
Can we check in the groin?
You can,
Show me where.
you can check it
And that's
out.
called whose pulse? You can ask for a consult.
Also,
Femoral.
Femoral pulse. Femoral pulse, and you're gonna check in a brachial pulse. Okay? Don't do adult medicine carotid pulse. You'll trying to get skin and fat out of the way of babies. You wanna do brachial pulse and femoral pulse, okay? Femoral pulses are okay. Okay? So you wanna count the heart rate now, right? How you gonna count heart rate? Miss Wolf? And I'll count it for you. You tell me what the pulse rate. Let me see you watch. All right, y'all. Rule in all nurses and doctors. Get a cheap watch with a second hand. Forget the Apple Watch and all that kind of stuff. Your watch is gonna be getting wet, gunky, poop, pee,
Yeah.
vomit, everything else on it. Timex takes the licking and keeps on ticking. Okay? You want to watch with a second hand. I am old school doctor. Easy way to do it. When the second hand gets on a whole number of a 4 or a 5, start your counting there. And when it gets 1 second past the next number, you've done 6 seconds, right? There are 10 6-second intervals in a minute, right? Whatever you get, multiply the answer by 10. You got his pulse rate. Okay? So it's beep. Go ahead, count it. You got beep. Butum, 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 bottom, 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 bum bum, bum bum, bum bum. You gotta give me a pulse rate. Bum bum. He's sitting there with a
I'm
pulse.
sorry.
Bum bum. What's your pulse rate? Bum bum.
I was up to 32.
Okay, you only go count for 6 seconds.
Oh, I was going all the way
If you
around
don't
a
tell me
minute.
till you counted a minute, that's a minute his heart rate has been down.
Okay.
6 seconds. You get 6 seconds
Okay.
to count off. Okay, let's go. Boom, 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 boom.
6.
boom. Hmm?
6 seconds. That's what I counted 6.
So how many? What's the pulse rate? You have to listen to me. 60. So I'm gonna just say 58. So 58, 60 or less. What you gonna do?
Continue.
No.
Just
Chest compressions. Miss Wolf, show me chest compressions in a baby.
Well, but that's
Go ahead. Okay. Put your hands all the way up under. Okay, pull this down.
I always have the shoulder problem going on.
Well,
Uh-huh.
that's me too. It's everybody. Okay, put your hands all the way up in his arms. All the way up in his arms. Put your thumbs here. Over. It'll just your fingers fall into place. You always want to compress the 1/2 to 1 inch.
I got you.
Okay, remember pulse rate 1 and 1 and 2 and 3 and 4
3.
and 1 and 2, 3 and 4 and 1 and 2. Baby heart rates are 130 to 160 a minute.
Okay.
Not adults. You're not in adult medicine. Okay? Okay, go ahead. You're breathing. You're breathing for me. Okay, so now you're
Yeah.
working on the airway. You're working on the breathing. You've cleared the airway. You worked on the breathing. You got a circulation. What else you want to do about the circulation?
Recheck his pulses again.
Okay, his pulse rate is up to 90.
Okay. Then I won't be doing.
You won't be doing CPR. What's next?
Um,
What goes along with circulation? Your heartbeat and color. What kind of color, Miss?
Helps.
Come on over. You shouldn't have said anything.
Yeah.
Come on. You shouldn't have spoke up. Sorry. Okay, so what's next?
Color.
Color. What kind of color?
Well, we want the baby to be red more so, not blue.
Yeah. Okay. But you want more so than red. You want what?
Pink.
Pink.
Second one.
How long to get pink?
Less than 3 seconds.
Less than 3 seconds. If it's more than 3 seconds, that's called. Starts with an S word. Not sinus. Not sinus.
cyanosis.
No, that's C.
No, what's it called?
S.
Starts with an S.
I just had a brain fart. Yeah.
You're not old enough for that.
Come
You you got 10 more years where you can do
It's
that.
after lunch.
What did I tell you? Right here.
Well, capillary refill.
Capillary refill. Capillary refill measures you
There
for
you go.
shock. Shock. You want to know, remember, just because your heart beating is not enough, you've got to get that blood and oxygen to where it's going to do some good, right? If his blood's just sitting there in his heart, just going up his aorta and coming back, you get nowhere. You got to know it. Shock is defined as decreased perfusion to end organs. That perfusion is oxygen, blood, volume, all those things. You have to make sure that's getting out there, right? And the way you do that is cap refill. Show me, Ms. Phelps, how you do cap refill.
Okay, I just generally do it on the hands. But on the baby, yeah, on the, I do the chest.
What are you doing? Show me what you're doing.
Just pinch.
Don't do it. Don't pinch my baby. You must be mad.
We just pinch.
Okay, do it. I want to see you do it. No. Nobody's gonna get me for sexual harassment. I don't do that. No, I'm not going down to my old age. Give me the hand. That's
Okay.
cap refill. Push down so you see it blanch out and let it go. Push it down for at least 2 to 3 seconds. Let it go.
Okay.
And 1, 1,000, 2, 1,000, 3. Not 1, 2, 3.
Okay.
1, 1,000, 2, 1,000, 3, 1,000. More than that, he's in shock. Okay? Have they had shock yet?
Yes.
Oh,
They know about
okay. His cap refill is 4 seconds, 5 seconds. What you gonna do? You're free to ask for a consult from your partners.
Consult. James.
What?
Mr. James? No, Mr. James has already been up.
Why not?
Sable?
Would you go back to
What's
chest
the question
compression?
about shock?
What you gonna do for it?
When you go back to
Oxygen.
chest compressions,
He's already getting oxygen.
chest compressions.
Fluids?
What kind of fluids? Good, fluids. You start an IV.
There
Okay, you go
go.
give him fluids,
Gotta
right?
perfuse him.
What are the two kinds of fluids you can give people?
LR and normal saline?
No. Not,
Isotonic.
no, try again, close.
Hyper and hypo.
It has
Hypotonic.
protein in it or it doesn't. If it doesn't have protein, it's called,
Hypotonic.
Hyper. What? Crystalloid.
Oh.
Crystalloid solution.
I wouldn't even know where my
Okay,
brain.
if it has protein, it's a colloid solution, right? Okay, name me a crystalloid solution, Miss. Oh, you down. Miss Gist. I've been getting over here. No, you've been over here. haven't you? Oh, I just like saying the name Gist. Miss Hill.
I have consult.
Okay, name me a crystalloid solution.
I'm like pinching on people.
You
Come
may
on.
ask Mr. James for a crystalloid solution. He's got an
Go
idea.
ahead, James.
I do? No, normal saline.
Normal saline
Oh,
is
okay.
a crystalloid solution. Give me another crystalloid solution.
Half normal?
Nope. Half normal is crystalloid, but you always use an isotonic solution. It means the sodium content is just about the same as your body. Because if you use a hypotonic solution, remember, if I have a salty solution here and one that doesn't have as much salt, then the salt's going to go from the high concentrate to the low concentrate. So where's that? That's going
Lactated
to
ring.
leak out of his blood vessels into his body tissue. You want it to be the same thing as his body. You got to be normal saline. Give me another one. Lactated ringer solution. Okay? Those are the big. Why? 'Cause you can go back to the shelf and pick those off the shelf. We keep that on every unit. You don't have, if I ask for blood, you got to do a type and cross match. You can use fresh frozen plasma. You can use albumin. You can use saltport albumin. All those have all those have protein in it. But if you do that, I've got to do a type and cross. And with saltport, with albumin, don't you have to mix it some kind of way and it foams up and you have to get all the foam out of it and all that kind of stuff? Fresh frozen
filter.
Yeah, you have to filter. Okay, with fresh frozen plasma, it has to thaw over a 4-hour period. Okay, you need something now. The thing you got now is a crystalloid solution. So you go give them a crystalloid solution, do they have to know how much? Okay, don't worry about it, okay? So you started as IV, you give them a crystalloid solution, and you give them the right amount, you can go do his cap refill again, right? What's his cap refill? Don't pinch that, baby.
1,000, 2,000, 3,000.
No, okay, that's how long you keep it down, but once you take it up, now you start to count. Okay, you put it down.
Okay.
1, 2, 3.
Okay.
Now, 1, 1,000, 2, 1,000. His cap refill is 2 seconds.
Okay.
Is he in shock or out of shock?
Not in shock.
Not in shock. So you take care of the airway, the breathing, the circulation. Next thing,
Blood sugar?
blood sugar. You must have heard my lecture statement. Blood Smarty pants, okay? Blood sugar. Come do his blood sugar, Miss Gatson. Come on, be smart. I got something for you, Miss Gatson. Okay? Show me how you do a blood sugar on a baby.
So we're gonna take the alcohol pad, wipe it. We're gonna get the little thingy.
Oh,
The lancet, the baby
lancet.
lancet. I'm sorry. We're gonna hit them, and then we're gonna wipe off the first piece
good.
of blood. And we're gonna, oh, let me hold it right, like a V shape. And then we're gonna get a sample. And then, boop, he's good. He's like at 65.
You can't give me this. I'm doing this. I'm sorry.
Yeah, exactly.
Okay. How come you didn't stick his toe? Why didn't you stick
He's
his
gonna
finger?
say 10.
No,
Now
you
what
don't
you
wanna
gonna
do
do?
that.
Why?
It's not big enough.
She's gonna damage the
more
vascular
Okay,
organ,
remember,
baby.
and again, I'm an old guy. In the old days, they taught you to draw a V, like that, and you stay in the outside the points in the V. Make the tip of the V right here, this heel, draw a V, and you stay on those corners. Easy way to do it. Okay? Is that what y'all teaching now?
Yeah.
Okay, do the V. Okay, so his blood sugar is 65.
65, he's good.
God, okay. So we done that. Okay, we've got to all this. What's the next thing? Y'all probably may not know this.
Temperature.
Temp. Very good. Y'all been listening, okay? Temp. So so his temperature is 94.
I got to turn it on and warm him up.
Okay? You turn it on, it's warming up. You turned it on, his temperature's still 94.
Check it rectally.
You take it rectally, it's 94.1.
Again.
A blood
Skin to skin, whose skin you gonna use? I'm hoping you're not gonna take off your shirt. Put him up against you in my nursery.
Just in case, you know.
Put a hat on.
Swallow it up, put a hat on it.
If you swaddle him up, think about it for a second. When I put you in a blanket,
You said
your
it.
husband put you in a blanket, okay? Put you in a blanket, you're generating heat, and you keep that heat in an enclosed area and you warm up, right? He's cold already. He's not generating any heat. So all you're doing is wrapping a cold baby in a blanket.
Did you say he was under the heat lamp already?
He's under the heat lamp already.
Can you put something else warm?
A bear
Like
hugger?
what? Give me an example.
A warm
Bear hugger,
blanket.
Miss
A warm
Johnson?
blanket?
Blanket or warm?
A
We don't
bear
have
hug?
a warm blanket.
Okay.
There's a thing back in the nursery we use, the ladies having C-sections, they keep warm blankets
Good job,
everywhere.
Bob.
Sable will tell you, down in the emergency room, there's a closet with warm blankets. Put them in a warm blanket, okay? So now, what else you gonna do to get his temperature up? Just to give all of you a hint, Miss Bonaparte's master's thesis was in babies on how they get cold. So I would pay particular attention to this if I were y'all. Probably go get questions on this, just as a guess, okay?
Feed him?
Huh?
We gonna feed him?
Feed him why? he's trying to die. And okay, you still got to get him warmed up first. Okay, so how do babies get cold?
They
What a
shiver.
They were not
Well,
Shivers the way to warm up.
Warm up, yeah.
Okay, air blowing across. He's wet. He's air blowing across a cold surface. It's called.
We're gonna dry him off.
Convection.
Go dry him off, but still, no, you answer the question. Get out. Answer the question, y'all. What's it called when you blow air across a surface?
Convection.
Convection. Think about convection ovens. If you have a convection oven, it heats up and has a fan in the back that circulates the air, and it heats things fast because it's more even I like cooking. There's more even temperatures in the oven, right? A convection oven.
So you put
So
it in
convection is just
Isolate? Did you put him in that?
can't do isolate. How you gonna do resuscitation?
I thought he was fine now.
No, he's not fine. I got a long way to go with y'all yet. I still got a lot more embarrassing to do yet. Okay, that's right. Okay, so you got convection. So you want to dry him off, right? You want to dry him off. You want to put you want to put him on some warm things around him. You want to get all the water off of him, right? Okay. What's another way to stop convection? To stop the air from rolling?
Close it up.
Close him up. Because that's why these are here. Okay, when you put these up, excuse me. That's why these are here. The air blows across it
Okay.
instead of on it. Pull these up. Okay? So those are convective losses, right? What's the other way babies lose heat?
The head.
Close.
Feet.
Close.
Condensation.
Not condensation.
No, I'm just thinking.
Okay.
Out loud. Unfortunately.
If I slap him on a cold bed,
Oh, I thought you
and
were
he's
talking
lying
about
up
slap me.
against a cold bed, that's called what? If you put your cold little hands on him, Miss Jenkins, what's that called? You married?
Transfer.
You married?
Transfer.
You married? You married?
Transfer.
That's why your husband gets upset when you put those cold hands and cold feet on him in the middle of the night.
Is it trans?
What's it called?
I don't know. I was gonna say transfer. Go.
Conduction.
Conduction.
Conduction. Okay, there's convection and conduction, right? Conduction means you're touching something and it's cold, so you want to get all the cold stuff off of it. Stop the air from blowing on it. You want to get all the cold. You want to get warm blankets. Sometimes we'll even take a glove and put warm water in it and put it up under his arms. Okay, we're doing conduction to try to get him warmer. In little bitty babies in the nursery, we call them bagging them. We'll actually put them in a plastic bag up to their neck. And that decreases the airflow across them and it keeps their heat in. We call it bagging them, okay? So now, you got his temperature and you've done all that, Miss Gadsden? Not you, done with you. Maybe, not yet, not yet, okay? So you've done all that and his temperature's up to 97. Okay, so now he's got airway, breathing, circulation going. He's got an IV in, okay? So now, what are you gonna do for post-resuscitation care?
Recovery.
Assess to see.
Reassess him, very good. So what are you gonna reassess?
We gonna look at his skin.
Never mind. Miss Johnson, come on over. Come on, come on.
He wants to.
Okay? So what are you gonna reassess? Everything.
Everything,
The
okay.
answer's everything. You will look at you go check his airway,
Mm-hmm.
you go see if he's breathing, okay, you go check his breath sounds. Your stethoscope, here.
Right on the bed. Okay.
I was gonna see if you gonna put that stethoscope on right.
I'm gonna listen to it.
What are you listening to right there? The answer's nothing. You listen, you checking his breath sounds, right? Check over here,
Okay,
checking over here,
okay,
okay? Up here and over here for his breath sounds,
okay.
okay?
I'm gonna listen here.
Okay? You hear breath sounds in all 4 quadrants?
Yes.
Let me check,
Third quadrant.
let me check. Oh, I don't hear any breath sounds in his left base. So what you gonna do?
Intubate.
Are you?
Just
Chest compression?
Are you?
Oh.
First thing you have to ask, does it make a difference? Maybe you just can't hear so good. Maybe he's
Okay.
got a mucus plug. How you go assess on how well his oxygenation is going?
Yeah, the O2 reading.
A what?
The O2 reading.
What's the O2 reading called? What
Pulse
machine?
ox-
Pulse oximeter. Where do you
Okay.
pull the pulse oximeter on the baby?
Like the
Right.
wrist. You
Try
can-
again. Where?
Wrist or the foot.
Wrist
or
where on the wrist?
The inside.
On the foot. Bottom of it.
You keep trying.
Palm of their hand.
Palm of their hand. Why? Which side? Right side, left side, up,
Right
up,
side.
hands or
Right.
feet?
Right.
Right side. Why the right side?
Furthest away from the heart.
Mm-hmm.
No.
Close. You doing good. It's a good effort.
Um,
Okay, remember your anatomy. Your
Fetal
heart sits
circulation.
like this. The blood vessels come up like the aorta comes. The blood gets pumped out this way, goes across your aortic arch and goes down. Right. There are 3 big blood vessels that come off the heart: the subclavian, the innominate, and the carotid. Okay, and the subclavian goes out to your right arm. Okay. Now, as you go down the aorta, the pulmonary artery, remember the ductus arteriosus goes from the pulmonary artery over to the aorta, right? So if I sample a sample of blood up here, that's pre-ductal, right? Before the ductus comes in. But if I check it on his left side or in his legs, that's post-ductal. Okay? That's because you want to know what his sets are before it has anything to do with the ductus arteriosus, right? Okay, where does the ductus arteriosus attach? What's it attach? What to what? Aorta to, huh? Aorta to, well, actually it's aorta, it's,
Yes, everything.
say it again, say it out loud. Pulmonary, oh, you were so close, you were so good, you had me going. Pulmonary artery. Remember, one of the few places where blood goes away from the heart is your pulmonary arteries. Everywhere else, that would be called a pulmonary vein, okay? But pulmonary artery goes from your right ventricle to your lungs. Babies don't need their lungs before they're born, right? Mama's doing the breathing for them. And so the babies have pulmonary hypertension, so the blood can't go through the lungs, so it gets shunted across the ductus before it gets to the heart, over to the aorta, out into the systemic circulation. Okay? But what you want to know is what are his saturations before you get to the ductus, right? Well, the ductus comes in downstream on the aorta, so it has to be on the right hand. When you take baby SaO2s, you always do it on the right hand, on the right side. Okay? Down the road, when you go do a thing when they go home called a CCHD. Critical congenital heart disease screening, okay? And you go do one here and one down here. Because if they don't match, remember the ductus ought to be closed by that time, so the SaO2 here and here ought to be pretty much the same. If it's good here and bad here, there's something blocking the blood from getting down here. There's something where the oxygenated blood can't get down here. There's a heart problem, there's a blood problem. That's why we do that test before they go home. Okay, and they go ask that. They always ask about critical congenital heart disease screening before babies go home. Okay? So now, you put the pulse ox on his right side and his SaO2 is 90. No, let's not do that to you. It's 80. What you gonna do? You had not
He's
gotten
not.
yet. Miss Butler, you thought you were gonna be good try. Good try. All right, you can quit sweating now.
Right now, thank you.
Okay, so his pulse ox is 60. You call Kilgore, he's like, take care of this. I'll see you in a few. Remember now, y'all, in all seriousness, your teacher's gonna tell you the doctor is not there 100% of the time. Y'all are there 100% of the time. It's up to you to take care of it till I get there. Okay? This little baby's alive, depending on you doing the right thing till I get there. Okay. Put him on oxygen. Put him on, give him some oxygen, okay? And you worry about his chest x-ray later, because there's nothing you gonna do about it anyway. But something's probably going on his right side that means he's not getting enough oxygen. So you go turn put him on oxygen and turn it up, right? Your job is to get the oxygen level up. So how you can put oxygen on it? Show me how you do blow by oxygen in the baby. Okay, and I'm gonna tell you no. I'm gonna tell you why. You have to do it like this, okay? Remember, babies are obligate nose breathers, so when you blow it, it's gonna blow right to his nose. Plus, you have to make way for his carbon dioxide to get out. If you do this, he's getting his oxygen, he's getting carbon dioxide too. What happens when you get too much carbon dioxide? Too easy.
Acidosis.
Huh? Say it again?
Acidosis.
Acidosis, you get what kind of acidosis?
Respiratory.
Respiratory acidosis, which means your carbon dioxide is too high. What happens when your carbon dioxide is too high? You get sleepy. You get sleepy. You get sleepy. You're going all the way backwards. You don't want his carbon dioxide. You want his carbon dioxide being blown off, right? So to make everything so it works, you want to hold it like this. We'll put it up on his chin and hold it like that. So now, see, you blowing it right into his nose, and you give him a chance to blow off the carbon dioxide. Okay, here you go. Okay, so you're giving him oxygen, and his pulse ox jumps up to 95. Oh, that's a good one, just because I hit it. We're at 4 minutes into it, and his SaO2 is 85. Is that bad or good?
I'm thinking you falling.
That's good for 4 minutes in.
Look at the sign. Look in front of it.
85?
Mm-hmm.
No, that's not good.
4 minutes in?
For 4 minutes in, that's good.
4 minutes in,
Aren't you saying
75.
85?
Yeah, 4 minutes in, 75 to 85. So he's above the guideline. If he was 74 in 4 minutes, we need to do something. Okay, this is what we look at. These are pre-ductal SaO2s before the baby's born. After the baby's born, babies are blue. Y'all know the difference in SaO2 and PaO2s, right? PaO2, you have to draw blood gas. It's partial pressure of oxygen in your blood. If you see a SaO2, that's a pulse oximeter. An SaO2 of 93, oxygen saturation of 93, is a PaO2 of about 69 to 70. Okay? So it's two different things, okay? Now, and we'll talk about somehow why that's not such a bad thing in babies, okay? But intrauterine PaO2s are 40, which correlates to an SaO2 of about 55 or so, okay? So babies don't just 1 second they're unoxygenated, the second they're oxygenated. It's a gradual increase. That's why babies cry. That's why we don't try to stop them from crying. They cry, they take a breath in, coughing out the amniotic fluid. If you saw the old pictures of the old doctors, they hold the babies up by the feet and smack their bottoms. That's why they used to do that, to make them cry. So you blow out the amniotic fluid, and when you breathe in, the air comes back in. Okay. Nowadays they're showing you don't have to do that. Okay. But you want the oxygen levels to come up, and it's a gradual up. So, and they're showing that a lot of doctors were giving too much oxygen. Stevie Wonder is blind because somebody gave him too much oxygen as a baby. There's a thing called retrolental, well, now it's called retinopathy of prematurity. Okay, my days it was called retrolental fibroplasia. But anyway, if you give babies are not designed, premature babies are not designed to have a whole lot of oxygen. Remember, if you're 34 weeks, you're supposed to still be inside your mom, and your PaO2 is only supposed to be 40 to 45. He was a premature baby, and they tried to keep his oxygen at 100%. And it makes the blood vessels grow on the retina of your eye, on the retina in the back of your eye, and he's got too many blood vessels and too much scarring in the back of his eyes. The doctors gave him his blindness. But that was the thinking back then, keep your oxygen up. Now they're saying, don't keep it up. That's why we keep this posted here. You always look at this on what's the good oxygen level and whether you need to give in it. So if he's just born, he's a minute old, and you're looking at his SaO2 is 60, we're in good shape. If he's 5 minutes old and 60, we need to give him oxygen. Okay? You always look at this. Okay? All right, questions so far, or what we doing? Okay. I didn't get the, you didn't do anything. No, you can't get away that easy. Okay, let's see. So you giving him his oxygen. His SaO2 is now, what I say, 80? 80 at 4. Y'all done a whole lot in 4 minutes, haven't you? And you go do it that way too when you come to my nursery. In spite of all this, those of you saw me do a physical this morning, that takes me 2 minutes. Okay? I've seen Miss Bonaparte doing it in 2.5 to 3. You will get to the point where you can look at a baby and tell something's wrong. If you come to the nursery, down in the ER, Sable will tell, I'm sorry, Miss Carter, we worked together too many times. She'll tell you, when they come in the door, you're a triage nurse, there's one over here with 104 and there's one here with a normal temperature. 104 doesn't mean that much. If the one over here is sick, you take them back first. The baby over here that's struggling to breathe versus the baby over there where he's blue and cyanotic, you go to the blue and cyanotic baby first. The one who's struggling, who's coughing and choking, give him a minute. Let me get this other one straight. Okay? You got to get so you can look at people and tell who's bad and who isn't. Okay? All right, so we're doing that. You got his IV going. What else you gonna do in post-resuscitation care? Basically redo everything, right? You gonna make sure his oxygen levels are fine. You gonna check and make sure his breathing is fine. You gonna check his capillary refill. Show me cap refill. Is 2 seconds. Is that good?
Yes.
It's 2 seconds. Okay, you go check it. You checked his circulation. Have you checked his pulses? Will you check pulses in babies? Femoral and what's the one under here called? Brachial. Femoral and brachial. His pulse rate is now 130 a minute, 140 a minute. Okay, so he's got, you've done all that. What's the next thing on the list? Airway, breathing, circulation. We go check another sugar. His sugar is now 140. You'll give him some insulin?
No.
No. Why? Hmm? Insulin make it go down.
He still has to get rid of all his mom's glucose. Gotta get rid of it,
Not quite.
right?
Close,
So
but not
that's why
quite.
it's so high.
What happens if you try to die, what happens? What chemicals do you put out in your body? Keep your heart rate going and keep your blood. Adrenaline. What does adrenaline do?
It speeds up
Keeps your
everything.
sugar up. Exactly right.
Yeah.
Very good. It makes your sugar go up. Okay, what else happens? You pump out steroids, right? What happens when you give somebody steroids? The sugar goes up. Okay, so a high blood sugar after resuscitation is normal. You don't do anything about it. You mess something up, okay? All right, so you checked his sugar, you checked his breathing, you checked his respirations. What's left? Is temperature, right? I'm sorry, his temperature? His temperature is now up to 97. So we're good, right? Last thing you will check is his IVs. You want to make sure there's no IV infiltration. You want to make sure it's running good. You want to check the pumps. Make sure the rates are right. You make sure all that stuff is right post-resuscitation, right? You make sure the baby's safe, the sides are up. You want to make sure all the stuff is put away. Make sure you take off your gloves and dispose of them properly. You go wash your hands, and then you go start doing everything else that has to be. Then you go start with everything else that Ms. Bonaparte's been drilling y'all this morning on, about the worrying about washing, talking to his mom, and all that kind of stuff. Okay? And trust me, they gonna be out there.
People just trying to keep under the blind.
And you have to go over the
Oh
Why you look so pitiful? You done good.
You just saved my baby.
You just saved my baby. You done good. Okay? All right, y'all, questions. Okay, so you're out at the family picnic and they pull the child. Now remember, y'all are nursing students, right? As far as everybody, all your relatives are concerned, you're a cardiologist, neurologist, neonatologist, dermatologist, what did I leave out? Internal medicine, pediatrician, you all of that to your family members. Huh?
Podiatrist.
Podiatrist, you all of that. So, all y'all in school, Yep, they're gonna, your family member's gonna ask, and you gonna be expected to take care of it. So you out at the family picnic, and they pull the child out of the water who's been trying to drown.
Oh, God.
So what are you gonna do?
Don't you have to ask the parents, can you?
Nope.
You
In an
don't?
emergency situation, there's a thing in South Carolina called the Good Samaritan Law.
Okay,
You could, anybody can help.
okay.
Go ahead, perfect, go ahead. Keep going,
Keep going.
keep going.
You check his airway.
Yep, keep going.
He's not
What else?
breathing.
Okay, what else you doing?
I mean, you start CPR.
Okay,
Rolling to the side.
give me a little bit more detail. You gonna do A, B, C.
Yeah.
Okay, you walking down the hallway, and a little child fall, you see him in the waiting room, and the child falls out the chair and has a seizure. What are you gonna do?
Turn on the side.
Nope,
You gotta
Protect.
you gonna check A, B, C. I don't care what it is. A, B, C, okay? You in the triage in the emergency room at night, they bring in a guy that fell off a ladder. You gonna do A, B, C. I don't care what the emergency is, y'all. Your job in the beginning is to stabilize them. It's not to figure out what's wrong. Your job is to stabilize them until somebody else gets there that can take over. Even in the emergency room. Y'all stabilize them, because how many times, Dr. Such and Such, I did something, I went to start an IV of lactated ringers and such and such and such and such, and they come in to take over, right? Your job is to stabilize them until somebody else gets there. If Kilgore's downstairs in the cafeteria, there's no way I can get here in less than 3 minutes. My best time is like 2.5. That was when I was young and could run the steps without a mask. Okay? Okay. It's up to you to take care of it. Miss Bonaparte we worked together a lot of years. She's taken care of a lot of babies till I've gotten there. A lot. She won't tell you she saved a lot of babies in her day till I've gotten there. Okay? Then I mess up her work sometimes. Now, another trick you need to know. You need to learn how to tell doctors what to do. Okay, you got to learn to tell doctors what to do without telling them. How many Dr. Such and Such, this patient came in and I started lactated ringers such. Basically, you told him this patient's in shock and you need to get your butt on over here now, right?
Right.
You need to learn to do that. Okay? You tell nurses, the good nurses learn to tell doctors what to do without telling them. And the easy way to do it is ask a question. Dr. Such and Such, would you like to start some fluids on this baby?
What you think about if we did da-da-da-da-da?
What do you think about such and such? Dr. Such and Such, do you need me to get a chest tube tray? Dr. Kilgore, do you think this baby needs to be on the Billy Rubin license? Yeah, I think that's a real good idea. I like that. Keep on, okay? Learn to tell people what to do. I told the other students this morning, those of you who didn't hear my daddy talk this morning, remember y'all in charge of somebody else's life now, okay? You're not a person that builds sidewalks, okay? The guy that builds a sidewalk, if it cracks, okay, they put down another sidewalk. You don't do this right, some little baby's gonna have a bad life, okay? Go home and learn this stuff your teachers are telling you. You passed the point of being baby girls now and baby boys, okay? Time to put your big drawers on, okay? Put your big, study this stuff, chapter 25. 23, I've heard so much, I don't know what's in it, but I've heard that so much. I don't know what's in that chapter. Everything in the world must be in that chapter. How to bake a cake must be in that chapter.
23.
Okay, go read that, y'all. Come back and just spit it off, okay? The other thing I try to get students to do is understand what you're doing. If you understand what's going on, you won't have to try to memorize it, okay? If you understand that the blood vessels here come out over here and the ductus is below it, then you understand why you're doing it on the right side. You don't even go to the left side. It needs to be on the right side. Well, I got an IV in it. We got to put it on the right side, y'all. It's got to be on the right side somewhere. But I'm going to get a pre-ductal SaO2, because remember, these are targeted pre-ductal SaO2s. Okay? You understand that you can do it. You don't have to memorize it. Okay? All right, Miss, who hadn't I gotten? Let's see. Come put this bag on me. Let me show you how you bag a baby. Smarty pants. Perfect. Very good. Okay, remember though, you're doing it, you're gonna pull up, put push down, okay? So you get a good seal, okay? Remember, you got to be able to see the nose, mouth in, the nose goes in the V, because remember, while you're doing mouth and nose in terms of blowing in, you really want to put the nose in, okay? As you're bagging, where's the air going? Where's the air going when you bag? Oh, that's too easy. That lungs and where else? Where else is it gonna go? Stomach, exactly right. It's gonna go in, and so if the baby gets a big stomach, it's gonna get real big. It's gonna push his diaphragm up, and you can't ventilate him as well, right? So what are you gonna do to get the air out of his stomach? Hmm? What you do to get air out of the baby's stomach? Say, tell him.
Is there something over there you can
There's a
use?
box.
Is there something
Open
over there
that
you can
box.
use?
Tube?
Open that box, guys.
What can you do? What can you do to get air out of the baby's
In the
stomach?
bait?
No.
If
Oh, the
baby's in his
CO2,
lungs.
Nope. Keep
What did
looking.
you say, Sam?
What the OG do?
OG tube.
Oh,
Put
find
OG
it. It's
tube
in there.
If you bagging a baby, they need to have an OG tube in, because remember, you're working against yourself. You can't control in a bag whether it goes down his lungs or down into his
I had the hand on it a
his
second
in his
ago.
stomach. So you need to get.
What
as
size
he
is that? That's a
blow
10, isn't it?
Blow his
Mhm,
stomach
just a 10
up.
French.
It's gonna
See if you
push his
find an 8.
diaphragm up, and he's not gonna be able to expand his lungs as much when you bag him.
There you go.
Okay? Okay? How do you measure, how do you put down an OG tube? Mr. James,
that's
come
a
put this OG
good-
tube for me.
Huh?
Come show me how you put in an OG tube.
Yes, sir.
You don't have it yet.
I got the 6.
That's not.
I mean, well,
That's not it. There should be one that's an 8.
Nose and softwood.
Oh yeah,
Is that right?
It's like nose, ears, and
Softwood,
diaphragm.
okay.
Yeah, look at it. Just took both
If you
of
took
them.
both those together, put the brain together.
Y'all got it?
Y'all bring the box
Where are we
over.
gonna put that? Where's that tube gonna end up? Where's that?
Come on, Mr. James, come show me how you put an OG tube in.
But that's how you do it in the belt. Because I had to put in the other day.
James.
She said one of y'all had it.
I told you. Read it. It says 8 French.
Just pretend you got on gloves. You don't have time.
Yes, pretend, that's fine.
alright. Same as a adult?
Hmm?
Would it be the same as a adult?
I don't know, I'm a pediatrician. I don't know. I don't know, I really don't. If you fall over trying to die in here, you're in trouble, buddy. You better hope your teachers know adult CPR, because I don't.
So I would measure from
Show me what you're doing, take the tube out. Show me what you're
going
doing.
over?
Yeah,
Okay.
it's the whole purpose of clinicals,
Yes,
doing
sir.
it. Doing it, get practice doing everything.
I have my gloves on.
Yep.
Wash my hands. We tried to measure it from the xiphoid process to the earlobe
Mhm.
to the nose.
That's how y'all teach it?
It's in reverse, I think, right?
I was gonna say, why don't you go from the earlobe to the nose
I'm looking at you. Oh, yes,
to the
sir.
xiphoid? What's all this about?
Well, I'm waiting for you to say, okay.
I was saying, is that something you teach y'all doing? New way of doing it? Okay,
All right.
so from the earlobe to the nose, to the bridge of the nose.
The bridge of the nose.
Let it go, let it go. Okay, hold it right
Tighten
there.
it up.
Okay. Now, put this down and let that go. Down to where?
Xiphoid.
Okay, where's the xiphoid?
Into the breastbone, right about it.
Okay, so now, you go mark where that is, how many centimeters that is,
Okay.
right?
Yes, sir.
And you go put it in.
All right. So then I would have some gel, surgical gel,
Go ahead.
and then we'll start pushing it through.
Okay, now, we don't do NG tubes in babies. We do OG tubes. Why?
OG2.
Babies are obligate nose breathers. If you
Okay.
put that tube down his nose, you cut off half his blood, half his ability to breathe.
Yes, sir.
So you do an OG tube in babies.
Okay.
Okay? So if you put his OG tube down, okay, let's say,
First of all, This is not the right tube, I'm sorry.
I was gonna ask you,
This
that's
is
a
a
suction
suction
catheter.
catheter.
Mm-hmm.
You
Oh, that's not
need-
what y'all use?
No, we use a OG tube or
Where's
a,
that?
look
Bring
in
her
the
to
box.
Kit.
So what you wanna
It might not.
find is,
you know it's not gonna be in there, right?
I know, of course, it's not.
Too
gonna
easy.
be in there.
Too easy. We'll show you one when we get back to the nursery.
Yeah,
But let's use that one right now.
okay. So
So,
we're pretending that that's,
so once you put it in, let's assume you've gotten it in, what you gonna do?
Once we got it in, then we're gonna check for placement to make sure that it's in the stomach and not in the lungs.
How you gonna check it?
Number one way is to try to aspirate
Okay?
with air, or to check to see what.
Can't aspirate
I'm
with
sorry,
air.
I apologize, that's my fault. Aspirate to see what comes out.
Mm-hmm.
Gastric content. Or if not, you can insert, you can push in air, but you have to listen for like the whoosh.
Okay, show me how you listen.
I'm gonna get my stethoscope, place it on, get a 30 or 60 cc syringe.
Yeah, I think that's a bit
Well-
much in the baby. Get out of adult medicine thinking. How about a 5 cc?
Yes, sir.
Got this in.
We got that in, and then listening for the in the stomach, and then you hear a gurgle
Mm-hmm.
as you insert air.
Okay. You don't hit a gurgle. What you gonna do?
Gonna pull out some and try to reinsert.
Okay. You do it again. You still don't hear a gurgle.
Then probably have to take it all the way out or get a chest X-ray to check.
Okay. If you check the chest X-ray,
I mean,
you see it's curled up right there. You can't pass it.
Then
That's
we-
not a fair question. No matter how much you try, you can't get it down there.
Then that's what we're gonna call the doc.
And that's exactly the right answer. That's exactly the right answer. The baby's got a thing called a tracheoesophageal fistula. He's got a blinding in trachea, and his esophagus actually attaches to his lungs. That's one of the tests for it. You can't get an OG tube in. Okay?
Yes, sir.
Okay, very good. So you got his OG tube in, you vented it, okay? And so how you go vent his stomach, okay? Because you start bagging him again, you go leave it in there, you go take it out.
Gonna. Well, wait a minute. Did you say we got did we deflate it?
You deflate it.
So for right now, we're until the doc says so. We'll probably leave it in.
You go leave it into a syringe, you go hook up the Gomco suction, what do you go do?
Probably. Well, we already deflated it. Probably low wall suction.
Will you?
Or probably more than likely.
Why don't you ask for a consult?
console? Anyone?
Just tape it to the side and
Tape
leave
it to the side and let it alone. It'll drain by itself. Okay, don't put it, if you put a syringe on it, the baby's not strong enough to push the air against the syringe. You can put the syringe too, but take the plunger out. You can do that, or you can just let it hang like this on the bed. Okay? All righty. All right, troops, y'all done good. You saved the baby.
Job.
He goes home in 2 days and grows up to be a nurse.